The Parliamentary Secretary to the Minister of Justice and the government's point person on the marijuana file, Bill Blair, the Conservative health critic, Colin, Carrie, and Marie Rankin, the NDP justice critic. Good to see you all, gentlemen.
Thank you.
Good to be here.
So there's lots to talk about, and I know this is not legislation, these are recommendations, but let's start with what I think will be the sort of one of the headlines, and that's the age that the task force has recommended, 18. Do you think that is too young, or does that sound about right to you?
The task force, they spent a lot of time listening to experts on the issue and discussing the right age. I think it's a recognition. Their recommendation appears to me a recognition that we're talking about adult use, and generally the age at which adulthood is recognized is at minimum 18.
Yep.
I think the report also indicates that the provinces can establish a higher level if they so choose. But the report goes on and says that in order for even an adult to make an informed choice, there needs to be a robust public education campaign, a real investment in prevention and treatment for those who get into trouble with the drug, and making sure people have the information available and reasonable limits on advertising, those types of things. To keep it away from young people, there are risks. And the medical advice, I think, is clear that there are risks associated to it, and that the younger that people start and the more frequently they use, the higher the risk. And so there are ways in which that can be prevented through an absolute restriction for people under 18. But the recommendation is that for people over 18, that those risks can and should be mitigated.
Okay, so let's get you two to weigh in on the age factor, because that'll be a big top line, I think, for lots of people. Colin, Carrie, is that the right age, do you think?
No, it's actually quite concerning, because when you're looking at an 18-year-old, you're actually looking at somebody still in high school. I think if you look at the evidence that's out there, there's significant evidence until the age of 25. Brain development, you can have serious and permanent disabilities, psychological problems develop. So I think when you're looking at the health and safety of Canadians, which I think is everybody's concern, you shouldn't be compromising.
But you can drink at 18 in most provinces.
Do you know what? And I recognize that. And I think that's a realistic argument. But when we set the ages for alcohol and smoking, we didn't know as much as we know today. Now there's solid evidence that says 25 should be the age. So we are a little bit disappointed that they would bring it at such a low age.
I think they looked at the evidence, and I agree with Bill on this general point that it was to be limited to adults. People are defined as adult under the provincial laws at 18 or 19, as the case may be, and I think that's the appropriate choice here.
Yes, go ahead.
Rosie, if I might jump in as well, the studies clearly indicate that right now, young people in Canada have the highest rates of marijuana use anywhere in the world. And the majority of marijuana users are under the age of 25, between the ages of 18 and 25. And I think the task force report recognizes that if we leave the prohibition in place for those between the ages of 18 and 25, they'll simply resort to the black market. And another important thing that the government has set out as one of our policy goals is to take the enormous profits that organized crime is making from this crime away from them and to leave an unregulated market, so that the supply that would be available to 18 and 25-year-olds is unregulated, untested, and unsafe.
Okay, but are we heading into a situation, given some of the recommendations in the task force, where they talk about how to market this? You know, to market almost it in the same way as we are now with tobacco, very plain packaging, nothing that would be attractive to kids, be very conscious of the edibles. Are we heading towards a situation where the government's about to legalize something and then spend a whole lot of money telling people not to do it? Is that what the kind of phenomenon we're going to end up with here?
Well, and this is one of the problems, because I'll disagree a little bit with my colleague Bill here. You have to give young people the benefit of the doubt. We've done a great educational program for smoking, for example, and we're down to, I think it's less than 12% of the population smokes on a daily basis, and it has gone down in kids. Kids, if you talk to them today, they think marijuana is an innocuous substance. They think there's no harm with it. So I think a better approach would have been to really put resources into prevention and education to allow it at 18 when we know scientifically that this is problematic up to age 25. I think it's somewhat irresponsible when Canadians are actually looking to the government for the health and safety to keep kids healthy.
Yeah, except Bill Blair's point is they're already doing it. They're doing it at 12, and then the consumption use is very high between 18 and 25.
Absolutely, and I agree with that point. But what I'm saying is we have a model with tobacco. We've shown that with proper education, kids you got to give them the credit. They're smart. They don't want to do things that are unhealthy. And the reality today is kids actually don't understand that this is a harmful substance. The chiefs of police came out and they said, you know, this may not be the way to go. So at the end of the day, I think let's be cautionary in the approach here. And I think the government, this is a task force. They don't have to take these recommendations. And I think moving forward, you shouldn't be compromising when you're looking at the health and safety of our youth.
Speaking of youth, what I think this report did not do, which really, really disturbs me, is it didn't do anything about, didn't even have a mandate to talk about young people getting criminal records. And I get people calling me saying, you know, my kid got busted for marijuana.
People
the Prime
smoking
Minister,
now, you mean?
Yeah, people smoking now. And they could say right now, let's decriminalize. Let's not let people get criminal records for something that's soon going to be perfectly legal. How do we justify that? Can't cross the border, can't get jobs, can't rent places, can't coach the soccer team because they got a record.
Except if there's one thing, I think you would agree, Mr. Rankin, if there's one thing that the report makes really clear is that this is way more complicated than anyone suggested. So to suggest that you can just decriminalize it and then...
I don't see why. I mean, it's virtually decriminalized in some provinces. There's no way you get even charged in the community I live. Whereas in Saskatoon or some other places, mothers write and say, you know, my child can't do any of these things, can't coach the soccer. How can we have a federal law that's applied so unevenly across this country? I don't understand that.
Mr. Blair, respond to that. You're not doing that. I mean, this isn't the first time Mr. Rankin
I think we've been very clear, and I think the task force has been also pretty clear in taking a very precautionary approach. And there's actually a very good discussion in that report as to why decriminalization doesn't achieve any of the social benefits that we are seeking in reducing social and health harms and keeping it away from kids.
Tell that to the 20,000 people who are going to get a record this year.
Well, Murray, what I would tell to anyone who's breaking the law is don't. That they should obey the law, and they should obey the law. What we have in place now is a flawed system of cannabis control, and what we are proposing to do, and which the task force provides us with, I think, some very, very helpful recommendations, is a way forward to a far more effective, comprehensive regulatory system of control.
I'm all for it.
And frankly, I think decriminalization makes it doesn't keep it away from kids. It doesn't take the profits away from organized crime. It doesn't reduce any of the social harms.
No, but
frankly, it makes it a little easier for the cops and not much else.
If you look at the reality, a year ago, the Prime Minister actually said the reason he's doing this is to keep it out of the hands of kids and keep the profits out of organized crime. So if you're looking at an overall approach, the government has rushed forward with this. They've told people they're going in this route. What's happened in the last year, Rosie? I think we've seen it in all our communities. We've seen these illegal dispensaries pop up, which are from organized crime. And what is their number one sales? It's a kid-friendly edibles.
But are you advocating that they decriminalize first? Is that what you're saying as well?
No, the government chose to make this promise. We didn't make this promise. So what I'm saying, though, if they're going to be going down this route, I think it's important that the opposition holds them to account to make sure that it's done in a way that is best for the Canadian
Here's what I want to know. If the legislation is going to be tabled in the spring, what is the timeline of this? Because as I said, it seems very complicated to me. All the things that have to be ready municipally, provincially, the kinds of regulations you need. How is this actually going to work? Do you have an idea of that, Mr. Blair?
Well,
great question.
I'll tell you, Rosie, I think the report makes it very clear the complexity of the challenge that we face, the importance of making sure that we make the right investments and putting a strong regulatory framework in place, that there's a strong public education component, that we continue to invest in research, and there's an enormous amount of work to be done with the provinces and territories because they bear a great responsibility, particularly around the retail framework that will be put in place. And so there's a great deal of work to be done, but we asked the task force to examine these very complex issues. They've done a very broad consultation. They've received over 30,000 online submissions, received hundreds of written submissions from a number of significant authorities, and they've done roundtable consultations with experts and with provinces and territories across the country. They've come back to us with, I think, a very comprehensive analysis of some of the issues and challenges we face, and we are committed to continuing to work forward on achieving our aims.
Colin, Carrie, then Murray,
No, but it was a great question you're saying by the spring. And sure, the Prime Minister has made a promise, but I think now that the information is out there, we shouldn't be moving forward and risk public safety just because there's a political promise out there. We have to look at the evidence for moving forward. If you look at some of the comments made by areas that have gone down this route, even the governor of Colorado was saying, slow down, make sure that you get this right. So if the government has chosen to move forward in this, we want to make sure that we make the right decisions. And at the end of the day, it's about protecting our youth
But
and the
Colin,
health
with
of
great
Canadians
respect-
with this program moving forward, because there is a risk.
With great respect, I think you've missed the point of the report, in that the report talks about how we can do a far better job of reducing the social and health harms that marijuana currently presents to the population in Canada today. It's a very comprehensive report that talks about how we can make things better and safer, how we can keep it out of the hands of kids, take the profits away from organized crime, and provide greater assurance
No,
to
I
the
don't
health
I
think
of
agree
that
with
Canadians.
all of that.
disagreed.
And
Mary
I think you're going to go right back to your question. They're going to introduce a bill.
Yeah.
Who knows if it's going to buy the recommendations in this report? Please remember, it's just recommendations.
Sure.
They might say, well, like some, we don't like others. A lot of them are in provincial jurisdiction anyway. So you bring a bill in, goes to committee, 3 readings, as you know, House and Senate. When will we have law? And when will they proclaim the law? It could be years from now.
Well,
Exactly.
are we? We're not months away. We're years away.
Well, we are talking about, in the spring of 2017, the health minister was very clear about bringing legislation forward.
Yeah, but
the legislative process, the parliamentary process is in passing that legislation.
But the government
and
decides when
also-
to proclaim.
And as well, putting the regulatory frameworks in
Right.
place, making the appropriate and
Years.
necessary investments. That's going to take time.
Before the
it's
next
a lot
election?
of work. And the report, I think, has been very helpful in identifying some of that, the challenges that we face as we go forward. And I think there's great value in that, but
And
trying
there's
to put a precise
opinions,
time frame
Bill.
on it.
But
The only
there's-
precise time frame that we've committed to is our Minister of Health has said she will bring legislation forward in the spring of 17. We know we've got a great deal of work to do to pass that legislation, and even more work to put the regulatory framework and all of the infrastructure that will be necessary in order to do this right.
So
And I will tell
years.
you, we are committed to taking the time to do it right.
Okay, I got to leave it there. Thank you all. Bill, Blair, Colin, Carrie, Mary, Rankin. Thank you, gentlemen. Thanks for coming down.
Thank
Thank
you.
you.